Hi, everyone, and welcome to the September 2022 webinar. We will be getting started just a moment, giving a minute or so for people to get logged in. Okay, I'm going to get started because we have a packed agenda and I want to make sure everybody gets a chance to talk and there's a chance for questions at the end. My name is Olivia Velez. I'm the co-chair of the Global Digital Health Network, and I want to welcome everyone to the September 2022 webinar, PEPFAR Digital Health Inventory, Building and Monitoring the Path to Sustainability. But before we get started, I just want to share a reminder that our upcoming Global Digital Health Forum is happening December 5th through the 7th. If you submitted an abstract, we will be getting out those acceptances in the next few weeks for the in-person event. The virtual acceptances will go out a few weeks after that. So keep an eye on your inbox, and we will also be sending out registration information right around the beginning of October. But our link is there to the website where you can get more information, and you can always reach out on the mailing list if you have more questions. So we're looking forward to seeing everyone in person this year who's able to make it. And we're so excited that we're able to host a virtual event that's truly global this year. So with that said, I'm going to pass it on to Kathy. Go ahead, Kathy.
Thank you, Olivia. Hi, everyone. My name is Kathy Pack, and I work with ICF International, and I support and lead the Digital Health Inventory team at PEPFAR. Today, we'll be talking about our PEPFAR Digital Health Inventory, Building and Monitoring the Path to Sustainability. We have a panel of DHI development and support team members here who will talk with us today. And then first, I want to introduce Mark DeZalia, who's our Information Systems Team Lead at the PEPFAR Coordination Office. Mark?
Great, thank you, Kathy. And can we move to the next slide, please? And one more slide, I think. Good afternoon, good morning, and good evening, everyone. As Kathy said, my name is Mark DeZalia. I work in the PEPFAR Coordination Office. I'm just so thrilled to have an opportunity to be with this group today and to talk about the work we've been doing on the digital health inventory data stream within PEPFAR. I think as anyone who participates in this program and in this network knows, PEPFAR has been working in the global HIV/AIDS space for 20 years next year. So we're about to turn 20. We have gone through a number of iterations of our program, and we're right now in a transition with coming from our previous ambassador, Burks, to our new ambassador, John Akingason. And the time is right for what we're doing in health system strengthening, with working with national governments and country-owned systems. And what we're doing, and we'll talk more about this digital health inventory, I think the timing is just so right, with a real focus in the PEPFAR program moving towards really making sure that we are moving away from parallel reporting and into using national data sourced from national systems. And so in some of the early iterations of the PEPFAR program, we have it on the slide here, there was very much, when it came to supporting the variable needs in the program for information systems and data interventions, a mentality of letting 1,000 flowers bloom. And the idea was this is sort of cast a lot of ideas out there, see what sticks. Let's figure this out, because the PEPFAR program very much had the E underlined in the early years, the emergency. And so we saw a lot of different types of interventions. We saw country teams that were doing wonderful things with their national governments. Through a couple other iterations of the PEPFAR program, there have been sort of a laser focus to HIV, to allowing more latitude to work more broadly on health systems strengthening, to our last iteration very much focused on our HIV clinical cascade monitoring, our 90-90-90 goals, and having data associated with those. We learned so much in the last years of having those quarterly data sourced from a variety of systems at the country level, but a lot of those tend to be parallel systems. And there's a major appetite for data for decision making within our program now, and we've had some confirmation from our leadership and from many stakeholders in our program just 2 weeks ago in a large data summit. We're just reaffirming the need for routine data to signal what's important in what we do in our program, but also to make sure that we're achieving those goals. I think what's really shifted as we're moving forward in a program is that how we get those data is as important, and finding ways in this next iteration of PEPFAR to put as much focus on the timeliness and the completeness of the data that we're getting for routine monitoring, but also really needing focus on the quality and where those are coming from. So finding ways to really incentivize country teams that are making those investments in sustainable workforce systems approaches at the country level. And I think very importantly, very strong support from our new ambassador, Nick Hangasong, coming from his time at supporting the global COVID response through WHO AFRO for 2 years, and working at the Africa CDC, that we are in the midst of 2 pandemics, a very disruptive pandemic with COVID, and the silent pandemic that we have been fighting within PEPFAR and beyond with HIV. And we know we have more to come. And it's so important for, as we're standing up these systems, the workforce, the approach we take, that we are applying the lessons we know very well in this discipline, in this domain, that the ideas we're applying here are not disease specific, and that there are challenges associated with the silos of funding, the silos of solutioning that really prevent that ability to scale intervention, and to make sure that those are applicable across disease areas. And so we are definitely moving away from the letting 1,000 flowers bloom. But what we've had a challenge with in this program, particularly in the informatics space for years, is we don't have a solid understanding of how country teams are addressing these challenges for a variety of reasons. And so when we talk, many times we have made attempts to talk about how we do things differently. A lot of it comes down to anecdotal responses. Well, I went to this country one time and there was an EMR there that didn't do this. And it's very hard to get past that sort of discussion with leadership without being able to say, well, here is actually a look at what we are funding for these sorts of digital interventions in this country. And here's a sense of where other partners are doing this as well. And so we have not had a good way to come in an evidence-driven way to get a seat at the table, talking about how this is working from country to country. During the COVID response, we were really focused on, as a lot of our leadership in the program was focused on COVID response, including Ambassador Burrs. We were working with our data use community, which many of the folks on the panel with me today have been instrumental in helping to get stood up. And in that open community, we were really hearing a lot of those same issues, that this is something folks are struggling with. And in the meantime, we also were very excited to be watching that the USAID had launched a map and match activity, where they were leveraging the pre-existing WHO Digital Health Atlas, which is a great concept, again, to get evidence-based understanding of where these systems are deployed to allow for a variety of different types of of funding, strategy, support discussions and coordination at a variety of different levels. But the challenge with the digital health atlas is there's no mandate for those entries to be populated. And so USAID was able to work through their partners and populate where their funded country teams and partners had been applying existing digital health interventions to apply to the COVID response. And so PEPFAR was really excited to see the enthusiasm from lots of stakeholders for this, and we put forward a recommendation through our data use community, informed by our data use community, and through our interagency informatics working group, that we recommend that we begin looking at a routine PEPFAR data stream that would be tracking where we are funding digital health interventions from country to country, and doing so in a way that aligned to the pre-existing data model with WHO, and with an expectation that we would be pushing a majority of those data we're collecting internally to review internally first to that digital health atlas, because we know that's going to be of key importance to a lot of those different coordination conversations at a number of levels. So we are there, and it is thanks to the team represented in this panel and many stakeholders we've worked with within the program and others, but we have collected across our largest operating units our first round of digital health inventory data that are allowing us to get better understanding of who we're funding to do what types of systems, and this is all reported at the partner level. And so it's we're going to go in more detail about this, but we're getting different perspectives from partners, often on the same digital health intervention. And what's key to this, and some of our colleagues have said as well, that this is so important, not that it is the definitive understanding of a landscape in any country, but that it is a conversation starter. It is, we have these observations, we have this indication, how do we then use those to facilitate dialogue within our own program? And then increasingly, as we're looking for more sustainable funding approaches, that we're bringing others in as well. So there is a lot to celebrate. We're so excited to get this started. In the meantime, as well, we are using all of these data to really mobilize our interagency informatics working group to make sure we have stronger cross-agency collaboration, understanding, and interpretation of these data. We fully expect that as we analyze this, the way we work, the way we support countries is going to evolve. And that's what we're really looking to for this data stream to do, and would expect for it to look somewhat different next year. But all indications are that at a lot of different levels, and we'll talk about some of the country feedback as well, no resistance to doing this. And we've actually received a lot of very sincere thanks for giving country teams an opportunity to have these conversations around what can be a very difficult space, and can also often struggle with definitional challenges. So people speaking past each other. And so I think one of the great opportunities with this as well is just to normalize the language a little bit, allow us to talk about apples and apples and oranges, and to build on it from there. So I'm going to pause my remarks. It's so grateful to have an opportunity for us to present our work here, and I'll turn it back to the team that really delivered on this. Thank you.
Thank you, Mark, for the rich background and the comprehensive introduction. Next, I'll hand it over to Kelly, who will give us a little bit more of the beginnings of the digital health inventory.
Great. Thank you so much, Kathy. Next slide, please. All right. Good morning, good afternoon, good evening. My name is Kelly Palmer, and I'm a program specialist with the DHI team. I'll be sharing background information about digital health and the digital health inventory. Next slide, please. Digital health is the systematic application of information and communications technologies, computer science, and data to support informed decision-making by individuals, the health workforce, and health systems to strengthen resilience to disease and improve health and wellness. Digital health incorporates the subdomains of e-health, medical informatics, health informatics, telemedicine, telehealth, and mHealth, as well as data analytics, big data, and artificial intelligence. Even when data and adaptive management are utilized. Health institutions that rely heavily on paper struggle to gather, share, and analyze data on outbreaks and operational responses at the speed required to keep pace with the spread of disease. Similarly, health institutions that rely on siloed digital systems that lack interoperability, which is the ability to rapidly exchange and compare data, often struggle to gather situational awareness that's required to effectively respond to a sudden disease outbreak. The full potential of digital technologies, data analytics, and the use of data can bolster preparedness for and response to pandemics and accelerate efforts to reach other global health goals. Next slide. The PEPFAR Digital Health Inventory. So understanding how PEPFAR and other cooperating agencies are investing in digital health is critical to maximizing the benefits received from such tools and will allow partners to leverage learnings and best practices across implementations. PEPFAR supports and endorses coordination amongst digital health investments across donors to maximize the impact of these investments. Digital health investments information helps us understand how PEPFAR is investing in digital health to inform planning, align investments across donors, lower burden, and increase utility of national digital health inventories, and identify scalable tools that help improve healthcare delivery. As a result of these objectives, the PEPFAR Digital Health Inventory, also known as the DHI, was created to inventory partially or wholly PEPFAR-funded digital health investments across system categories listed here on the slide on an annual basis within DATM and DHIS2. Implementing partners enter digital health investments that address 4 sections in the DHI. The general information section focuses on the name of the digital health investment, the organization and staff roles. Coverage and funding section focuses on the PEPFAR mechanism name, funding sources and budget, funding timeline, implementation status, and geographic coverage of the digital health investment. The system category questions identify functions under the DHI related to the selected category or categories mentioned above. They assess interoperability and use of open source platforms and licensing. The data security section focuses on access, storage of personally identifiable information, security scanning, and correcting of flaws. Once a DHI entry is submitted, country teams review and confirm submissions, then analyze the data via Panorama and/or the DHI structured data set. The DHI is capturing information on system categories commonly seen in PEPFAR, which will be mapped to the WHO Digital Health Atlas for public access. Next slide, please. The PEPFAR Digital Health Inventory was developed in close collaboration with an interagency informatics working group and a broader advisory group comprising of WHO aligned to their Digital Health Atlas product, the Bill and Melinda Gates Foundation, and the Global Fund, with extensive stakeholder feedback from across implementing partners in the Ministries of Health, with Uganda, Vietnam, and Zimbabwe supporting us through our pilot and beyond, and the CDC and also the USAID. So thank you so much for all of our stakeholders and partnerships in helping us get here today. Next slide, please. Thank you. And now I will hand it over to Alicia Smith to present on implementation approach.
Thank you, Kelly, and hello, everyone. So my name is Alicia Smith, and I'm the project manager on the team, and I'll be covering our implementation approach and just touch on our implementation plan, roadmap, and give you a quick highlight of some of the numbers we like to share. Next slide. So to implement DHI, we followed a 4-step approach focused on stakeholder engagement, country key informant interviews, implementing a pilot, and then deploying a version 1.0 release. So for stakeholder engagement, we wanted them to be involved as early as possible and as often as possible. So we met with several different agencies, outlined the DHI value proposition, identified the data use needs, and then began gathering requirements from these engagements. We also began engaging with the WHO Digital Health Atlas team just to ensure that we align with their goals. As we continue to engage our key stakeholders, the next step we took was to conduct the country key informant interviews. We had 3 countries involved in the process, which was also observed by the US agencies such as CDC, USAID, and DoD. Our aim was just to socialize the initial instrument created in our Microsoft Word document, review and test questions, and with the selected pilot countries, then refine and finalize the questions based on the feedback we received. So from these key informant interviews, we were able to also understand how to implement several process flows and also just to generate some test data, which were used to help finalize on our technical solution. With the refined version of the questions, we then began prioritizing those questions and then developing and then began development activities for a pilot version. Once the data collection period was completed, we held several data reviews with the pilot countries and then provide them with some insights with what was collected. Leveraging the lessons learned from our pilot, we refined, prioritized the questions again, and then we were able to deploy another version of the tool, which was rolled out to more countries. And then during this version 1 release, we were also focused on implementing the ability to complete data analysis as well. Next slide, please. So one thing to note is that our implementation approach was done over 2 fiscal years. So in FY21 Q1, we completed the release with the data collection process of the pilot data with Uganda, Vietnam, and Zimbabwe, just reiterating that. And then in Q2 of this year, we began data reviews for the pilot countries, which was completed. We also held focus group discussions to gather feedback and just to let stakeholders share ways that they think we could improve the tool as well as maximize the data use. For Q3 was when we began refining the tool again, deploying the version 1 release, and then began prepping for this data analysis review. The data collection period ended on September 16th, which was last week. And now we're currently preparing to begin the data reviews with PEPFAR HQ and country teams. We're also in the very early stage of planning focus groups discussions to provide stakeholders with the opportunity to discuss some lessons learned that they've gotten from this year, and then just to provide ways that they think we could improve the DHI tool for next year. Next slide. So here are a few numbers. We received entries from over 230 implementing partners spread across 22 countries, which include our initial 3 piloted countries. We also collected over 80 data points, and now we have over 575 entries in the tool. Next slide, please. Over to you, Dennis.
Thank you, Alicia. Dennis Banga, working as a software engineer with the team, and I'll be taking us through the technical implementation of the DHI tool. Next slide, please. So when it came to implementing the digital health inventory tool, a number of things were considered, looking at the current landscape that we were in. And one of the main things is currently, most of the PEPFAR data streams are reported through DATIM, which is a DHIS2 system. And so we have most of the users currently who are very familiar with the system, both from the implementing partners, from the country, the USD country teams, to the global users who interact with these systems on a daily basis. So they are very familiar with the DHIS2 system. And so that was one of the systems that we needed to look into for us to look at how we can implement that. But nevertheless, so based on the DHI data set and the questions that are collected, they don't fit easily within the DHIS2 data model from the event, from the tracker and the aggregate. So we needed to look for a way to implement that within DHIS2, extending its capabilities by building a custom solution. So we went forward and we built a custom solution. And so I'll be able to share with you how the tool is structured. So the tool is structured, it has two parts. It has the front-end side, and also it has the back-end service. And the front-end side is built on React.js, utilizing also some open source libraries, the Material UI, and also the DHIS2 UI for the user interface. And also we have a REST API that serves the front-end application or the client application, and this client and this REST and this API service is built on AWS services, and it's built on Python stack, and also it also integrates with other AWS services that we are using for storing different data types. And so this service, the REST service, it runs on the AWS API gateway, and also it utilizes the S3 service for storing some of the static files or the attachments that are uploaded within the DHI tool. And also the data is stored on a Dynamo database, which is a NoSQL, a key value data store, just to also promote the extensibility and also the scalability of the data that we are collecting based on the nature of that data. And also additionally, also we use the DHIS2 data store for also collecting, for storing configurations for the application. And as you can see, so the users have to log in through Dating, which is the DHIS2 platform. And then after that, they can interact with the DHI application, which is an application that's running within Dating. And with that, they're able to be authenticated, they're able to be authorized based on their different user types. If they are logging in as an implementing partner or an agency or a global user. So based on the level of access, the users will have the appropriate permissions within the application. And with that, now they're able to access the tool, and they're able to either, if it's a partner, they're able to provide the questions that are provided through the different sections. And then after that, they're able to submit that information. And later on, we'll see how the review and approval works. So the stack is on DHIS2, and then also utilizing services from AWS for providing the backend service and storage of data. Next slide, please. So when it comes to some of the features that we have and some of the functionalities that we have in place on the DHI application, as you can see on my left, that's a snapshot of just the application. So the application is built on DHIS2, and it's built using some of the available tools that are provided, the app platform tools and libraries, just to ensure the consistency of the tool, and also for us also to utilize some of the already provided functionalities within some of these app platform tools. So the tool also has an intuitive data capture flow, and also how the questions are presented within the questionnaire, making it easy for people to capture this information when they are filling through the different sections. And also it has also an intuitive data review workflow, as we also be able to show and highlight, that helps the different users who are responsible for reviewing or maybe linking DHI investments together. So it provides that user-friendly interface to allow users to do that, and also ensure quality of data that's captured within the system. So the other functionalities or the other areas that also the DHI tool supports, it supports various data types. Looking at the questions, we have multi-select questions, we have single select questions, and also we have some questions which also require some files or attachments, PDFs, for questions that are requesting maybe for them to provide additional information. And also we have some questions which are numerical, and also others which allow free text, or maybe when they are supposed to provide more information. So it supports the various data types. And so these data types are what are collected within the system, and then they are pushed on the data store, pushed on the Dynamo database. Yeah, so the other bit is also that the system ensures value type compliance to ensure the integrity, and also to ensure the quality of data that's captured, so that all the information that's captured, it's within what's defined within the data set. Additionally, also on the tool, we have some tooltips, and also we have some inline guides also to help the users when they're navigating through. They can easily be able to check and clarify some of the terminologies or some of the questions or some of the options provided, just for them to be quite familiar with whatever they are feeling, so that to facilitate also quality collection of data for the investment they are reporting on. Additionally, also we have some conditional or cascaded logics within the system to allow the users just be able to, because the questionnaire is based on a number of questions, and at times some of these questions won't apply to specific investments. So when they select those options, so some of the questions are hidden, or some other questions are also provided based on the selections they are providing. Additionally, also, and also, as I highlighted, we utilized the dating platform. Also, we preload some of the information already for the users based on the implementing mechanism or the implementing partner who is working. So we're able to provide some of the information that's already available within the system. So to make it easy for the users not to fill everything from blank, but to provide the only information that's not available within the dating system. So additionally, also, as I highlighted, we have real-time data validation checks within the system. And this also to ensure the integrity of the data that's being collected. And also, when it comes to the metadata, so we have the metadata of all the questionnaires. They are stored in a standardized way, and also the management of the metadata of all the questions that we have managed also just to ensure we can be able to track changes, and we can also be able to maintain versions. So with that, we're able to ensure the tool is scalable and it's extensible, so we can have and we can add questions dynamically, and these questions are already pre-populated within the tool. Additionally, also within the application, we ensure the users are always authenticated and also authorized to access the service. So because we know all the users who are going to log into the platform will need to have the appropriate permissions to access their application. And how we do this, we utilize the user groups and the user roles to be able to control who can do what within the system. And so we have permissions already in place within the platform to support that. Next slide, please. So when it comes to how the DHIs are reviewed and how they are confirmed, so it takes a process. And as you look on this diagram, we have a new investment will always be in progress. And so the people who are responsible for creating or adding investments within the system are the implementing partners who are working within the countries. And so they'll be able to report the investments that they are currently supporting the country on. And so those investments, until they are submitted, those investments will be in progress. But once they are submitted, they'll be pending review. And so those will be part of the submitted investment. And so with that, now we can have the agency teams within the countries who will be able to facilitate the review of these investments, just reviewing whatever was submitted based on the DHI instrument. And with that, they're able to check if there are any changes that will need to be done. They can be able to request updates, and and those investments will go back to the implementing partner. And so they'll be able to see those investments that they've been requested to update, and they'll be able to update and then submit it back. And then it will go back to the review of the submitted entries. And if the entries are okay, they'll be confirmed, and they'll now be they'll be confirmed, and those now will be tagged within the system as confirmed investments. And also there are some investments which are submitted and maybe they have more questions, or maybe they don't apply for that reporting period. So those entries also can be put on hold within the system. Also, it offers that functionality. So when we look at some of the users category, as I have highlighted, so we have a number of users within the system just to enable and facilitate this process end to end. So we have the implementing partners who will be reporting these investments. Also, we have the agencies at the country level who will be responsible for reviewing and also approving these entries. And also they are also responsible to link similar investments. We can have investments reported by the partners which are similar. So we also have a feature within the system to link a similar investment, so they are grouped together. And lastly, also we have user access for inter-agency teams within the countries, and also global users or global agencies who are also able to just view the investments which are submitted within the system. Next slide, please. So I'll hand it over to Priya.
Hello, everyone. My name is Priyadarshini Karthik, working as a data scientist at ICF International. I'll be providing an overview of the DHI analytics framework. Next slide, please. On this slide, we have listed some of the analysis questions we explored using the early DHI data. So we did preliminary analysis on how the digital investments is used, looked at the overall budget reported by the investments, and how the countries are using the digital investments. We also looked at the DHI geography coverage. And in order to understand the broader digital health landscape, we looked at the proportion of the DHIs funded by other donors. And we also looked at whether the PEPFAR funded systems are being leveraged for COVID surveillance and response processes. Next slide, please. So here on this slide, we have an illustrative representation of reported DHI categories across the operating units. Based on the data that is reported in the tool, we see that majority of the DHIs fall under the HIS category. The graph below shows the DHIs and their implementation statuses. Based on the reported data, we see that majority of the DHIs reported are in the fully functional category, followed by the scaling up implementation status. Next slide, please. So this is an example. This is a representation of whether the PEPFAR funded systems are leveraged for COVID surveillance and monitoring processes. So based on the data reported, we see that 40% of the DHIs support COVID surveillance, and 20% of these identified systems support services such as tracking vaccination status, COVID-19 prevention, and monitoring vaccine status. And 9% of these identified systems are used for COVID lab test reports. Next slide, please. So here on this slide, we have the DHI and the DHIs and the PEPFAR supported program areas they are aligned with. So based on the reported data, we see that majority of the DHIs fall under the care and treatment program area. Next slide, please. So now we'll talk about some of our next steps. Next slide, please. So from the analysis perspective, the first release of the DHI focuses on DHI data alone. So some of our next steps in this aspect include working with the country teams to verify the data, comparing the DHI data against other data streams, monitoring and reporting data stream workforce and program quality indicators. From the data perspective, DHI collects data on PEPFAR funded investments alone. So in the future, we are looking to integrate with WHO Digital Health Atlas to get an overall picture of the digital investments landscape. Next slide, please. So these are some of the helpful resources. So we have provided links to the DHI support page, the data use community, the PEPFAR COP guidance, and many others. So this concludes our presentation. Thank you.
Thank you to our panelists. We will now open up a time for Q&A. I do also have with us as part of our panel during this Q&A time, our solutions architect and technical lead for the Digital Health Inventory Project, Vlad Shiosvili, and the panelists, and even some of our participants will be able to answer some of the questions that you have. So we've received a number of questions through the Q&A function, and please feel free to add additional questions to the function, or you could type in your question in the chat. While others are thinking of their question, I will start with one of the questions in the Q&A that I have not answered yet. So who is the tool intended for in terms of geographic coverage and the specific stakeholders who will use the tool? The tool has been launched this year to 23 of PEPFAR countries, and the implementing partner completes this information, but the use of this data and information can be used for countries for country operational planning, and to see where the gaps and redundancies are in terms of their digital health interventions. PEPFAR will also use this information to understand where and how investments are used, and the MOH and other donor organizations are able to use this information to align investments. As I had mentioned in one of the earlier questions, the information in this tool will be available to a subset of the information in this tool will be available through the Digital Health Atlas around the January 2023 timeframe. And of course, that will be available to the public. Okay, and I have another question here. Is this tool relevant only for users leveraging depending on PEPFAR investments? Will it capture investments across the globe in digital health? Thank you for that question. Right now, this first year, we wanted to focus our attention on the PEPFAR investments. However, during the pilot, as our panelists have mentioned, we have worked with, in particular, Global Fund and WHO and Bill and Melinda Gates and ministries of health to pilot this tool and then also to get their feedback. And so we hope to scale this tool up to understand the broader landscape. Of course, PEPFAR is just a piece of the landscape, and you know, we want to understand the full landscape. So we hope to expand this tool to other donor agencies as well as the Ministry of Health in the future. But this first year has been focused on PEPFAR funding. Are there any questions from the audience? Maybe you could raise your hand and we can unmute you. Okay, I see a hand raised. I'm not sure if somebody can unmute them.
Hi,
Joseph, you've been given permission to speak, so please ask your question.
Okay, great. Thanks. Can you hear me?
Loud and clear. Thank
Okay,
you.
great. This is great, great work, and really appreciate all the work that PEPFAR has been doing over the years. I really was heartened to hear the shift in the perspective from kind of going after the disease-focused approach, which was absolutely necessary in the early days, to more of a broad ecosystem and what I would call a person-centered model, because I really think that's the key to really leveraging digital health beyond that. In that context, I'm wondering, because the inventories are excellent ways of measuring current state, but they don't necessarily feed into where you want to be in the future, because you're kind of looking at what you've already done to some extent. And I'm just wondering how you're factoring that, looking at beyond the areas that you've been used to working in, looking for examples to feed into your thinking and into the ecosystem. Over.
Thank you very much for your question. I'm looking through our participants right now and seeing if there's anybody else who would like to address that, but maybe I'll start and others can chime in. So essentially, in the slide that Priya had presented last, can you go over one more slide before this one? Okay. Oh, no, the next slide. Yeah, perfect. Thank you so much. So if you go into the PEPFAR Digital Health Inventory support page, you can actually see the instrument that we used this year. And it's in a Word document, and you're able to see the questions. So the idea was, and we worked very closely with not only an interagency group, but with our MOHs and our other donors in the HIV space. And we have developed questions that allude to some of the maturity of the digital health interventions that we are using and building, and then the sustainability of our solutions. And so we wanted to get a little bit more insight into the maturity and the sustainability of our solutions. And so our questions were geared to, some of our questions were geared toward that. So for example, in the system categories that we have used, there are drill down questions where you can understand, and I think Priya went through some of just the overall illustrative analysis, but where you can drill down to how it's being used or how it's planned on being used. And, you know, such questions of like, do you use any global goods or any platforms for unique identifiers, which of course is important to person-centric monitoring and planning and systems. And so we tried to gear toward that. But of course, there are definitely ways that we can improve the instrument and further dive deeper into the planning aspect of it as we move forward.
Great. Great. Thank you. Now our focus has been primarily in the area of immunization management and in primary care and so forth. And so we're seeing a lot of synergy with being able to support, and we already support in some cases HIV and so forth, but you know, taking that broader perspective is really, I think, going to be very effective from a number of angles, including sustainability and so forth.
Yeah, absolutely. And as I had mentioned to one of the Q&A questions, please feel free to contact us, and we could definitely, I think, bring heads together and brainstorm on how we can, you know, get our MOHs more involved in this process, and then also to engage in other health focus areas, as well as you know, understanding the information that would be helpful to us for planning and the future state.
Thank you very much.
Thank you. Okay, I think we have time for a few more questions. Laura Evans, do you want to unmute and then ask your question?
Sure, just wanted to ask if the tool itself is going to be open to the public, and maybe it was said, but I might have missed it, or if all the information is going to be integrated into the Digital Health Atlas, and then we can access it from there. Thank you. Over.
Yeah, absolutely. You know, we've, of course, this was an interagency effort, and Mark Tazalia mentioned in the beginning that we've been working closely with the Map and Match team at USAID. And of course, at PEPFAR, we have our USAID colleagues. And one of the visions that we had discussed was to, make this available to the public, and so that there won't be multiple ways, like the country is building a tool like this, and then PEPFAR has this tool, and then the different donor agencies have a tool like this. So we want to make it more of a truly a global good. But right now, this first year, we have focused on PEPFAR invested initiatives, and we rolled out this tool in July to 23 of the high volume PEPFAR countries, and our implementation partners complete this information. But then, as I had mentioned earlier, of course, the data is used by PEPFAR to understand the landscape, our donor agencies to understand it better, and then our country teams for planning purposes. So a subset of this information is going to be available this first year, just because we're trying to negotiate and navigate through the sensitive areas for the country and the MOH there, and the various needs that they have in terms of consuming and providing this information. And so we decided to have a subset of the required questions in the Digital Health Atlas available to the general public in the December to January timeframe. Thank you for your question. Lungi or Coco, if you want to unmute and ask your question.
Hi, yes, no, thank you for your presentation. It's exciting to see this move forward. So I had a question around the approval process, and I was wondering, it sounded like it's mainly PEPFAR country teams that are approving new entries that are submitted by partners. Wondering if there's a role for Ministry of Health, especially if they have an HIS department, or even some sort of an e-health unit in the countries that have those, or even a role for the National Digital Health Working Group if one exists in a country.
Absolutely, and of course the right now the tool is such that it's really focused on the PEPFAR coordination office in the country is sort of doing exactly that, coordinating this. So from our information at SCAC in terms of funding allocations, we have a baseline list of partners who have noted that they have digital health investments. And so the PEPFAR coordination office at the country level would coordinate with the activity managers in country and with the MOH to ensure that certain implementing partners who need to report on their digital health investments would report to this tool. And then, of course, the results and the information can be discussed via the PEPFAR coordination office with the ministries of health and other donor agencies, and of course our implementing partners. However, for this year right now, we do not have the functionality where the Ministry of Health can go directly into the tool and provide the review. But as we're thinking to making this tool more useful for various stakeholder groups, that's definitely something that we'd like to consider and discuss further as we think of the broad list of stakeholders who would benefit from this information. Thank you for that question.
I think we've got one person that's just raised his hand, although I think he might have just taken his hand down. I was going to say it looked like we had one more question. If that person would like to go ahead and ask it, that would be great.
I'm not hearing anything. Are you? Okay.
Yep. No, I think they might have decided not to ask the question. So.
Oh, I see Tewodros
Yep.
off mic, but I just can't hear anything.
Tewodros, did you have a question you wanted to ask? Oh, he's going to go ahead and type it.
Okay, wonderful.
Oh, we know that whole situation with the mic. No worries.
Yeah.
So.
I think your question, I think you're saying that you sort of manage the digital health investment information in your ministry. Yes. Okay. Awesome. So yeah, as I had mentioned, the PEPFAR coordination office in country has been working closely with the ministries of health where appropriate, especially in a country like Uganda, where during the pilot we found that the ministry was very interested in this tool and also using this information. So the ministries of health really use this information to understand the landscape of digital health interventions, and then also to for planning purposes. Once they are able to understand, the gaps and the redundancies of our digital health landscape, then they're able to plan better for the future and work closely with the implementing partners to make planning decisions for their investments. Okay, and I think I'm being cued that this will be the last question, and so Carrie, I'll hand it over to you, or Olivia. I'm not sure who's going to close.
I'll close.
Yeah.
Yeah, thank you everyone for attending our meeting today. And just as a reminder, if you are not already a member of the Global Digital Health Network's mailing list, it is free, and there's the link to sign up. This is where we post the recordings and the slides. You can ask questions, you can post your information, and if you're interested in doing a presentation, you can reach out to us there. So thank you again for everyone to joining. Thank you everybody from the DHI team for presenting today. And we hope to see you online or in person at the Global Digital Health Forum in December. Take care, everyone.
Thank you.
Thank you.
Thank you. Take care.